Good afternoon, everybody. I just want to welcome you to the NEC and Town of Henniker question and answer with Vice President Wayne Lesperance. I'm Joe Devine, your Town Administrator for the Town of Henniker. I'm going to be serving as the moderator for this afternoon's Town Hall session. NEC has been working hard on their plans for the 2020 reopening for this fall session, but given the pandemic that we're all dealing with at the present time, we thought it'd be good to get them together so that they kind of share what their reopening plan is going to look like for everybody. In a moment, I'm going to ask the panelists to introduce themselves. But at first, I wanted to let you know that there are some cues that we're going to be going over on how you can ask questions and things like that. We have enabled the chat box for people, and that is how we're going to be utilizing questions and answers. So if you have a question, feel free to put it in the chat, and we will do our best to get to it. We have a limited amount of time that we're going to be working with this, but we're going to do our best to get to all questions that everybody has. As the panelists see them, like I said, we'll go ahead and answer them. Now, without any further ado, I'd like to ask our participants this afternoon to introduce themselves. Again, we have several people from the Town of Henniker here. We have members of NEC here. So we're just going to go through and hit that out. First, I'd like to introduce Dr. Wayne Lesperance. Be unmuted.
Thanks, Joe. Very happy to be here and happy to answer any questions that folks have. Talk to you a little bit about what we're working on. I'm joined by Senior Vice President and our Chief Financial Officer, Paul Amato, as well from NEC. And I can see in our groupings here that we have at least one faculty member on, and the faculty moderator, Mark Mitch, is here as well. So we look forward to answering any questions you have and to tell you a little bit about our plans.
And then from the Town of Henniker, we have Select Board Chair Chris Blomback here, Selectman Leon Parker. I saw Police Chief Matt French here. I also saw Emergency Management Director Steph Costello enter the room. So we want to welcome everybody. I believe actually letting in Lieutenant Keaton Gagney as well from the fire department. So to start the discussion, I'm going to let opening comments come from NEC. So Wayne, if you want to start us off.
Sure, and Paula, feel free to jump in as needed. So basically, I'd start with directing everybody to the website. We have maintained a record of all of our communications with members of our community. We have anything that we've put out to the public. We have now, as of our last meeting, certainly made sure we included sharing that with the select board so that they're receiving those as well. And then you can see our plans. The plans are evolving. They certainly change as new information becomes available. So I think the last time that we spoke to you all, we described what we were doing with regards, for example, to testing as something that we were working on. And I'm very pleased to say that that is something that has evolved to the positive. We are now in a place where we know every community member, anybody coming onto the campus of New England College, student, faculty, staff, will be tested before classes begin. And that will be part of our onboarding process for all students, new and returning. We know that we were working on what we might do in the event we had positive cases and how we would report that out. So we have some processes in place for that were still very much under development the last time we spoke. So I think my point in mentioning those two pieces is that the process continues to evolve based on our ability to get commitments from partners from the state and in this case of testing from a company, Convenient MD, you guys may be familiar with, that will be physically present on campus to conduct the testing. We've changed some of our practices in the past. We've had one move-in day. That was a very, very busy day. Move-in day will now be move-in week. The purpose of that is to extend out the time that students have to arrive, get tested, get settled. And the idea there is to make sure that we can do everything, all of our work, in as socially distanced a way as possible. Some of the things that we talked about last time that probably bear repeating is that our class size is limited to 10. We continue to follow the guidelines from the CDC about limiting groupings of individuals who are not in the same quote unquote bubble to 10 folks. And so we've implemented that. We have been able to develop a cleaning plan for our classrooms. Every classroom will be cleaned after every use. So as you can imagine, that transforms our schedule. We've had to extend our day. We've had to make some changes. Student classes will meet for 1 hour per class per week, typically. In the cases of a lab science or a more hands-on class which requires setup, that time can be extended. But again, it's very much a limitation on the amount of time individuals are spending face-to-face in any environment. We're going to be having classes that take place outside. As long as the weather permits, we're going to be doing an awful lot of things outside on campus, again, to take advantage of better conditions for mitigating against the spread of COVID-19. So just as a quick overview then, what I would say to you all and what we've said to the parents and the students that are coming to NEC is that we begin and end each day with focus on how can we do the work that we do, how can we provide a quality education that is safe and healthy. That is absolutely what is our guiding post here in the work that we're doing. There's many more specifics I'd be happy to share. They're available on the website, but I'm absolutely happy to talk about them. Paula, is there any other just specific points that are significantly different from the last time that we met with folks in town you want to share?
I don't recall. We may have talked about our thermometer plan.
Yeah.
So we are issuing thermometers to all of our students, staff, and faculty who will be on campus, and requiring or requesting that they take their temperature at least twice a day. But we also purchased some infrared thermometer machines that will take infrared temperature control for students, anyone entering 2 of our larger buildings. So we're hoping to get them outside the dining hall. We know students living on campus will be going there. So it's one place we know we can capture any issues and try and address any issues up front. And the thermometer program that we have are grouped by buildings. So if we start to see a spike in temperatures going up, now we know that that is not necessarily related to the virus. It could be a sinus infection. It couldn't be the regular flu. It could be strep throat, whatever the different things are. But if we start seeing issues there, we can jump on board, get those people tested again quicker, sooner, and we can also get our wellness center involved earlier and take some early action. So that's one of the things that we're trying to focus on is early intervention to prevent anything spreading should we start seeing something happening. But I think, Wayne, you addressed all the other issues.
Yeah, just the last point on the thermometers. These are smart thermometers that connect to an app that all the students will have on their phones or on their devices. And what's great about it is that if you have a temperature over, I think it's 100.8, the app then it triggers a series of questions for you, which are the standard COVID questions that you would expect to get if you go to the dentist or anywhere else, loss of taste, smell, those sorts of things. And what it does is it instructs the students to, if enough of those things are checked, or if there's concern about potential for COVID infection, it directs them to our wellness center to get help immediately. And then, so this is a really important part of the effort that we have. One of the places of the public information campaign or the public health information campaign that we're doing with our community members to make sure that if there's any concern that they've been exposed or that they may be symptomatic, that we get them in front of a medical professional to get the help, and then as needed, get them to medical facilities in Concord or elsewhere. So that's another piece of it that's relatively new to the planning that we've done. Pretty significant investment from us, but the idea here is to really try to get out in front of any infections or any spread of the infections. This all ties in as well to a contact tracing program. It connects with, the things that you're very used to hearing, I think, on the news about what we ought to be doing to try to flatten the curve and to mitigate against the spread of COVID-19.
Great, thanks, Wayne. Obviously, I see some questions coming in already, so we'll just kind of start tackling those first off. Let's see, there's going to be any coordination between landlords and NEC as far as CDC compliance for off-campus living?
Paula, do you want to talk a little bit about how we manage relationships with folks that rent out apartments?
Well, we don't have any control over any of the landlords in town. We will be requiring students to follow certain rules. What they do in their apartment, we can't control. We can control when they're out on the street or on campus. And we certainly are being proactive as far as making sure that they do what they're required to do. We have a Pilgrim Promise that they have to abide by, whether they're on campus or off campus, such as wearing masks full time if they're out in public, even walking down the street or on campus outside of their residence halls or outside of their apartment. That is a requirement. So that's just one example. There are some things we can't control, but we are working with students to make sure they understand what social distancing is and to not have parties and things like that. We're doing what we can to educate them up front.
Great, and I think that's an important point. Whatever happens off campus is subject to, the laws of the town, but certainly I'd like to be in a position, or we'd like to be in a position where if students are engaged in behavior off campus that is inconsistent with what they have committed to on campus, and they're all aware of this, that's grounds from dismissal from the face-to-face learning environment. We will send them home. We are going to run our learning both face-to-face and online. So we have the option, a student has the option of saying, you know what, I can't live by your rules. I don't want to commit to that. So I'll stay home. That's perfectly okay from our point of view. If they decide to come and then they decide not to follow the rules, they'll be sent home, and they'll be sent home without a refund. We've communicated all of this. This is a significant, there's some significant stakes here for the students if they decide not to be compliant. So I saw someone posted a question about off-campus parties. We can't tell a person who is renting a private apartment that they can't have a party. But if it comes to our attention that they're having gatherings with more than 10 people in an enclosed space and they're not engaged in appropriate social distancing, they will have to transition to off-campus learning. Whether they decide to move home or not, we can't evict them. It's not our property, but we can certainly limit what they can do on our campus. I would like to work very closely with Chief French on this. I think he's definitely open to that. We've talked a little bit about this. We've got more to do there, but I think that's certainly our approach. I guess the big takeaway here is that we take this very seriously. We're putting not only increasing some risk here for folks who are on this call, who are members of the community, of the town that I live in, that you live in, but also all of the faculty who tend to be older folks who tend to have some higher risks, all of the staff that come to work at NEC. So we take this very seriously, and we've laid out a pretty aggressive approach to this with our students to let them know that if you're not going to follow the rules, you shouldn't come to campus. And if you get here and don't follow the rules, you'll be sent home without a refund. That's a pretty hard line to take with the students, I think.
Chief French, do you want to speak a little bit about your relationship with the college and how you're working towards that?
Yeah, absolutely. Like Wayne said, we've already had some conversations about this. Obviously, we need to dial in some more solid information. We've always been forthcoming with information sharing with them, so I don't really see that being an issue for us at all.
Great. Chief French, there is a question that's geared towards the police. Will Henniker Police be responsible for breaking up these parties and taking names to report to NEC?
Well, I think that goes back to what I said. Anytime we have contact with any students in a law enforcement capacity, we always give that information back to the college for them to do with whatever it is they do.
Great, thank you, Chief. So I have a question that came in online. Obviously, there's going to be some testing protocols that you've explained. Will NEC implement throughout the school year any additional testing? And then what would the tracing procedures be for positive tests that are returned?
So the answer to the first part of the question is absolutely. We'll be doing what's called surveillance testing. So we take a percentage of our population, and right now we're depending on what we can get agreement to do through our partner, we're looking at roughly every 7 to 10 days having subsequent testing. So throughout the semester, what we're telling students, they could expect that it's possible they'll be tested 4 or 5 times. We'll be doing that regularly. But it's a sample. Any student that has got exposure or a student who has tested positive, any of the students that have come in contact with that positive case will be evaluated for additional testing as well. So that's standard with regard to the response to a positive case or exposure. All of that testing is in place for us through the partnership with CommunionMD. And we're actually also talking with the state and the National Guard to have a site on campus as well that can provide even more frequency of testing. That's the only reason I sort of vacillate a little bit on the timeline. We'd like to get it to be basically as needed, and if the National Guard can help us achieve that, we would do that. So yes on all of that. Contact tracing guidelines come to us from the DHHS. They have not released the finalized guidelines on that we've seen. It's something that all the private colleges and universities have been asking for. We're a part of a group that's working on that with the Department of Ed. And so once we have those, we'll implement them, but at least what we've seen thus far is pretty consistent with what's described by the CDC for contact tracing, and we've got that plan in place. If there's any tweaks to that have to happen, we'll make those. We're going to absolutely be 100% compliant with what the state mandates for us to do. That's not a question we would raise. We would just do what we're told.
Great, thank you. Just going through some of these here. Let's see. How soon after a positive test would a student be sent home, and what provisions are NEC making to isolate positive cases on campus or in private housing?
Yep. So we have three facilities, two primary facilities that we've taken offline. So these are some of the smaller houses we have on campus that we are going to turn into. One is going to be an isolation facility. One is going to be a quarantine facility. So the isolation facility are for students who have become exposed, but we have not yet had results of the test to determine whether or not they're positive. So we would separate them from students who have a positive test. The only students we would quarantine are students that live further than 3 hours away or have no ability to get home. If a student tests positive and is within that 3-hour driving range of the campus, we will work with their families to get them back home. And so that's the, we want to get them back home to their families' medical care and all of that. If a student is from Hawaii or from Texas or from abroad, and we can't put them on a plane, we can't get them back home easily, then we have an obligation to take care of them. And so we will have quarantine space on campus for that. We'll communicate that space to all the emergency services folks in town, and we were prepared to do that already. We will bring meals to those students. We will have trash removal by a partner that can take care of that in a safe way. And so we will take care of those students in that space. And obviously we want to make sure that the municipal authorities and the state will know about all of these as well and where they're being housed. So the answer to that question is yes. If in a nightmare scenario, and we contemplate all of these kinds of things, we have a circumstance where the numbers are growing to a point where we can no longer accommodate them, then I can assure you that we would be coordinating with municipal authorities, we'd be coordinating with the state, but certainly the president of the college would want to know about this, obviously, after the first case, and then we would be planning on what we do next. There will come a point if we thought we could not accommodate the need, that we would make the decision to transition to remote learning, and we would send our students back home. That's what we're working against having to do, but it's certainly something we've planned for in case that it's required of us.
Great. Let's see, this says the Pilgrim Promise only addresses on-campus behavior. What about off-campus, wearing masks, social distancing in town?
Yeah, so the Pilgrim's Promise is applicable to any student that wants to learn on our campus. So it doesn't just have to do with when they're on campus. If they're engaging in risky behavior off campus, then they forfeit their continued time with us face-to-face in that environment. So the supposition at the top of that question was incorrect. This applies to any student that wants to continue learning face-to-face on campus. The only difference is we can't go into their apartments to see what they're doing, right? There's private residences at that point. And so we would rely on working with the students, working with Chief French and his team and others to let us know if they're seeing behavior that's inappropriate, and we would act on that.
Do you think there's any help that could be given from either White Birch, Rotary, Henniker, Chamber of Commerce, people like that to aid you guys?
We could always use help. We would always be very happy to work with those partners in finding help. So I guess what I would say is I would love the opportunity to talk with them about what we're doing and see if they see obvious places in which they might be able to assist us. But yeah, sure, we'd love to have that help. Paula, anything on your mind about that?
No, I mean, absolutely happy to have the conversation with them.
Sure.
All right, can the town of Henniker have a mask mandate which could help students understand its importance everywhere? I can answer that a little bit for you. A lot of towns have been trying to figure out how they can enact ordinances for masks. With pending litigation, a lot of towns have been a little bit shy. There is a case out of Nashua where Nashua has made a mask ordinance. It is being challenged right now in the Supreme Court. So a lot of towns are trying to make advisories, things like that, as far as the recommendation that people wear masks. But a lot of legal counsel has come out and spoken against that. I know the towns of Durham, Hanover, Keene specifically are trying to get the governor to try to take a little bit harder stance. If you notice, those are all college towns as well, trying to make that a mandate. The Board of Selectmen here can make a resolution or an ordinance if they so choose to try to make it an advisory. But I think our legal counsel would advise right now with pending litigation against actually making it a mandate. So.
Hey, Joe, I mean, back to the question about how the Chamber of Commerce might be of assistance.
Sure.
If it was appropriate and they were willing to do so, encouraging private businesses to adopt a must have a mask to enter rule would go a long way. That does not require an ordinance from the town. They can simply make that determination privately. A lot of businesses are doing that across the state, across the country. So that would be something. The more normal it is to have a mask on, the more likely you are to have students and community members wearing masks.
Great. How many students are you anticipating at the Henniker campus this year?
On campus, we're looking at about 650 students total. In Henniker. Manchester is a different number, about just under 300 in Manchester.
Let's see. Has there been any contact been initiated with landlords?
I think on a case-by-case basis, as students have talked about moving places, we try to guide them to landlords that we know have been responsive to our requests or supportive. You know, if we have concerns about a landlord not having a safe environment or there've been issues, we tend to steer students away from those folks. There aren't many of those, thankfully. But no, there hasn't, to my knowledge anyway, there hasn't been a universal outreach to all landlords in town. I don't know that there's a list of all the landlords in town anywhere that anybody has. But we would certainly be happy to work on that. If somebody wants to work with us on that, that would be great. We would love to do that.
What we can do, just so you know, we can, under our assessing, pull any multifamilies and things like that to kind of get an idea of who is out there as far as landlords go. So we're happy to help you with that.
That'd be great, Joe. I'd love to work with you on that.
Yeah. There seems to be a lot of questions about masks. A lot of the emails I have is about the mask policy. So can we just really go over the mask policy, make sure everybody understands exactly what the mask policy is going to be for NEC, so there's no questions.
Yep. So students are being asked in all of our communications to plan on having at least 4 masks with them on campus. We are going to issue them masks as well with the NEC brand on it. You know, it's a cloth mask that will last. It's not a disposable. It's a one that can last the whole term. Masks are to be worn in all public spaces. The only places their students will not have to wear masks is in their residence halls or in their actually rooms, their residence rooms, or the shower or the bathroom for obvious practical reasons. When they go to dining services, they'll have to wear masks and have their temperature taken before entering. They can remove their masks to actually consume their meals, but then they'll have to put them back on upon leaving. Walking around campus, walking in their classrooms, masks are required. Nobody will be admitted into a building on campus without masks being in place and properly worn, right? So you've all seen the videos of people wearing them on their chins or not covering their noses. They have to be properly worn. And we have instructional videos that are being created to that end. The students who are out on athletic fields or who are alone, so if a student decides to go for a walk on the trails or something like that, as long as they're alone, there's no one around them, they can take their masks off. If they become into contact with others, they're to put their masks back on. Those are the general guidelines.
And we will also require staff and faculty to wear masks on campus, unless they're in their private office with the door shut, but they will be required to also wear masks.
So we have a question that says, NEC seems to be relying upon the direction of the State Division of Health and Human Services, but after what's happened in the rest of the country, how do we believe that HHS will do a better job?
I guess what I would say is that we rely on the CDC, the DHHS, and common sense. And the common sense is based on what we have seen and read as being effective in the country. I don't know that I'm not in a position to evaluate the DHHS. I wouldn't choose to do so, or the CDC, but I think the science is out there and it's pretty well established and we're following that.
We have a question. Are you going to be putting up any tasteful billboards around town to remind students of the guidelines? Or at least on campus?
We certainly will have lots of signs on campus of all variety with regard to washing hands and wearing masks and all of the things that are good practice. We have no plans to put anything up around town proper. I don't even know that that's something we can do, to be honest. But that's not been part of our plan. And I suspect that we'd have folks from town that would not like to see NEC signs all over town. So I wouldn't want to assume that that would be okay.
We kind of talked a little bit about the contact tracing. Will the tracing be shared with town government, and what influence does the town government have over the operation of college? Well, I can answer that we have really no say over the operation of the college as a private entity. You know, obviously we want to work in collaboration for the residents of the town and then for the residents of NEC. So that would be my answer to the town government's role over the operation.
What was the first part of the question, Jeff?
Are you going to be sharing any of the contract tracing with town government?
Well, I think we're obligated to, and we would certainly want to coordinate with emergency management services, with the chief, police department, and the fire chief EMS. And so yes, and I imagine we would also be sharing this with you, Joe, and with the select board. So the answer is yes. I guess I'm not, clear if there are other offices who want us to share things with.
And I think I can answer that a little bit too. When these positives are going to be reported again to DHHS and through them, we also receive a list letting us know of positives as well. So even if the college wasn't giving it to us, we'd be getting it through the state as those positive tests come back as well. So answer that. Do any of the panelists, Chief French, do you have anything you'd like to say? Selectman Parker, Chairman Blomback? No?
Nope.
Okay. You're good, Chief French? All right. Steph Costello, I saw you in here. I can't find you at this point, but do we have any more questions from people? I've got the questions that we've asked, and obviously we've hit all the ones that were in the chat box from people. Thank you, Steph. I guess, I'll turn it back to you, Wayne, as well. Oh, well, I missed one. Let's take a look. The risk seems so high, it can lead to out of control spread. Why not just do online learning until the pandemic is more under control? You're muted, Wayne.
Wayne, I can start that one and then you can jump in. Well, one, we have a lot of students who learn better face-to-face, and that would certainly be a consideration. Many of our students want to come back, but I think, a lot of the issues with being remote is that a lot of it is financial, which is why we're taking so seriously making sure that we follow as many rules and regulations that we can and enforce that with our students. But certainly we need to make sure that the institution is sustainable moving forward. And if we did not have students living on campus, that would be difficult to do. So it's a combination of academics, having students right there in the classroom, being able to work with their faculty, but also financial.
No, I think that's it. I wouldn't add anything to that.
Chief Fresh, you wanted to add something?
Yeah, I did. Wayne, you said there's going to be 650 students on campus. How does that compare to last year, for example?
I think last year we had over 800 students. So it's about, I think it was 830 exact is the number that jumps to mind. So it's about 200 less. I'll tell you that we've had overwhelming response from our students that they want to return. We've talked to about 600 of them on the telephone or via email directly to really get a sense of, do they want to come back? And it's been overwhelming. So I think that's typical of a lot of colleges right now. Students are telling us they don't feel that they learn as well remotely as they do face-to-face. And so we want to meet them where they are. That's sort of our approach. So I see Mark Mitch on there. Mark is, I think, top with students as well. He's one of our faculty members. Mark, if you want to say something about that.
Let me unmark. Say, there you go, Mark.
Yeah, the students I've talked with have all been very excited about being in the classroom. I'd say there's big demand to be one-on-one, so they really want the face-to-face experience. And we're hearing this nationally. I mean, at all schools, this is the big push that they want to reopen, and that students really want to be in the classroom with their instructors. The only other piece I might add to this is we're also going to have I think it's the same number or so. We're also going to have commuter students too. So there will be people driving onto campus. So it's more than just that 650.
Right.
I don't know what that number is.
Great.
There's a question in the chat, Joe, about where our students come from. Overwhelmingly from New England states. In terms of our incoming class, I think the largest number are coming from New Hampshire itself. These are new students, followed closely behind that by Massachusetts. That's pretty typical. When I talk about students coming from Hawaii, I think we have 6 coming from Hawaii this year. Texas, Florida are down. Those numbers are relatively low this time, yeah, but overwhelmingly from New England, from New Hampshire and Massachusetts primarily.
So I got a question that came in. Latest data shows that 80% of the states have increased COVID infections, hospitalizations, and deaths after reopening. Have you scaled back on any of the plans or number of students as a result of these failed openings?
I think that there's some self-selection happening by students and families. We've had some students and families decide that they'd like to stay online for the year because of their concern around that. That has had an impact. That's part of why our numbers are down year over year from last year in terms of those that want to be on campus. But we have not restricted them. What we have put in place are the mitigating factors of making sure that they're all tested and that they're COVID free. So just to be clear, it's not just taking a test, but it's showing the results of a negative test result before they get access to our classrooms. So that's for us the way that we make sure that we don't have an infected population coming into the campus, and then the monitoring of them through testing throughout the semester is the follow-up to that, along with contact tracing and everything else that we're doing.
So we'll put it out there for one last time if anybody has any additional questions, and then we'll wrap this up if there are none. I guess it's on my website. There's a section that's coronavirus updates, but there haven't been any updates in 2.5 months. The reason is because the state's been updating their website constantly, and so we're referring people to DHHS rather than just repeating the same information that's already getting put out there through DHHS. So.
So Joe, the last thing I guess I would just share is that we're certainly happy to do this again. You know, if we want to do this again in August before the students arrive, I'm happy to do it again. I know Paula would be more than happy to do that, and we can certainly join you for another version of this.
Great. Can I ask Wayne just one other thing? I know you've talked a little bit about it when you were the selectman. Maybe can you talk about just the consolidated schedule and the time people are going to be on campus, just so everybody's aware of that as well?
Sure, absolutely. So we have changed our semester schedule. So typically our term would run from the last week of August through the middle of December. This year, our fall semester is going to start the last week on August the 24th and will end on November the 22nd. So before Thanksgiving, we're sending our students home. There's no fall break, so we're not sending our students away for a week and then bringing them back. For reasons that we want to limit their exposure to COVID and then bringing them back into our community. And so this is an intensified term in the sense that instead of being 15 weeks long, it's 13 weeks long without a break. And so they'll go away back home or wherever they go over the holiday break, which will be from Thanksgiving all the way till February 1st. We will not bring students back until February the 1st to start our spring semester, which is about 2 weeks later than we normally would start. And then we'll end on time on May the 8th or May the 7th. May the 8th is graduation, we hope, in Henniker. And so that's the shortened spring, shortened fall, no fall break, no spring break. An extended winter break becomes about a 7-week winter break. And that's the change in the calendar. And part of what's driving that is all of the talk that's out there about yet another wave coming in time with cold and flu season. And so we're trying to minimize the amount of time that they're going to be here during the heart of that, of the winter. And so that's the big change on that schedule. And I think I mentioned earlier that our face-to-face contact time with students is limited, right? We've shortened it from, say, 6 hours a week over 2 or 3 days per class to 1 hour or 2 hours per week, depending on the class. So we've cut back on the contact time. We've also encouraged students to take an online winter course so they can lighten their load in the fall. So instead of taking 4 or 5 classes, they can take 3 or 4, just maintain their full-time status, but spread their load out with one online course in the winter, which would again reduce the amount of interaction between students and faculty in a classroom setting. So we're trying to do everything we can to make this as safe and healthy as possible. As I said, that's kind of the guidelines that we've gotten from the president, and we're gonna embrace that and put that into practice.
Great. A couple questions came in while you were talking. Is President Perkins planning on being on campus?
President has been on campus throughout. The president will continue to be on campus.
And then are you depending on the state to read the tests and report positive and negative results?
We
Or is Convenient MD going to be actually reading the results?
get the results straight back. I believe, Paula, it comes back from the lab directly, doesn't it?
Correct, yes. So we'll have a roster of individuals can check their own tests, but we will get a roster of positive and negatives.
Yeah, so I don't know how many folks have had the tests. I went to CVS for my test, and the results came directly to me via their portal from the lab, not from CVS. And my understanding is that's the same for the MD process. Sorry, go ahead, Joe.
Do you have an idea what the turnaround time will be from Convenient MD then?
We're told by Convenient MD it's 2 to 5 days. Is that right, Paula?
Correct. But they also said that it will depend on what testing is going on at that point, because they still rely on other labs that are doing it for other organizations.
And so you know what we're hearing now is that for some labs it's taking up to 7 days. One of the things that we have done is we've decided that not to start face-to-face in the first week of classes. We'll stay remote the first week to make sure we have all test results in before anybody is allowed into the classrooms on our campus. If it takes longer, we'll stay remote until we have all the tests in, and we're confident that we can do this safely.
And we're also doing the same thing with dining services. So students will have a takeout option only during that time while we're waiting for tests. So we don't have anyone congregating, even though it'll be limited space in the dining hall. We're not going to have any of that happening while we're waiting for test results to come back.
Yep. So, and Rob Reno asks who to contact in case that folks are seeing compliance issues. Certainly, they should reach out to our campus safety office on campus. I'm hesitant to share the email address only because this is Facebook, but it's available on the website for sure. If you just look up campus safety, you can find it, and email them or give them a call, and they'll be happy to take that information from you.
And then another question came in. Do you have any regulations for visitors and friends on campus?
Yes, we will not be having those. Students will not be allowed to have guests come into their residence halls. They will not be having those folks on campus. Even like guest speakers we'll be doing via Zoom like this, not having them come live on campus. We have a fall convocation that we typically do. That's a live event. We'll be doing that remotely. So we'll have a guest speaker that'll be joining us via Zoom. Even vendors that need to come for delivery purposes, all of that has to be coordinated through Paula's office if it's contracted services and all of that. Pretty much the only thing that we allow to come on campus without a request is emergency services and the post office.
So I'm not seeing any other questions. So I want to just thank everybody for coming today, especially visitors to off-campus housing.
Off-campus housing, if you mean our residence halls off-campus, those are subject to the same rules I just described to you. If you're talking about a private residence that a student, is renting an apartment, we don't have any control over those spaces.
So I want to thank our partners at NEC for coming in and talking to the town and talking to us and kind of trying to just be transparent and let us know exactly what's going on. I want to thank the residents and everybody else for coming out. I do think we're going to be scheduling another one of these. Wayne and I have been in discussions about that. So Hopefully we'll have another one for the second week of August, right before the students really start getting back, just in case anything has changed. And again, so we can get that information out there.
Great. Thanks, Joe. Thanks, everyone. Thanks for your
Thank
questions.
you.
Thank you very much again, everybody.